Welcome everyone to our session called Assessment of Fluency. My name is Andrea Bertoni, and I am a speech language pathologist that works for the Wisconsin Department of Public Instruction. I've worked here for 3 years, and before that I worked in a large school district for 18 years at all levels. I'm joined today with our fluency expert, Laura Johnson, who I've known since graduate school. I don't have the initials after your name, Laura, but you also are ASHA certified, board certified fluency, correct?
That's correct, yes. Board certified specialist, that was in 2018. So I retired recently from the Madison School District after about 20 years. And I also am on the board for the American Board of Fluency and Fluency Disorder as treasurer. I started in January, and I have a slide if anyone is interested in becoming board certified. Certainly don't hesitate to contact me. And I think that's about it. Right now I have a small private practice, mainly teletherapy, focusing on fluency disorders and stuttering.
I'd like to thank the Wisconsin Statewide Parent Educator Initiative, or WISPE, for allowing us to use the Zoom platform today. And as you all are probably aware, we have a new rule for speech language impairment that went into effect for referrals starting on or after August 1st. I wanted to share with you a couple of resources that I have shared previously, the summary of changes for the speech or language impairment rule, revisions, there's a side-by-side document, there's some videos that are an overview, and then next week on September 15th, we have a digging deeper session as well. So today I just wanted to frame the assessment of fluency presentation that Laura is going to be presenting on and ground us in the comprehensive assessment model that I've been talking about with folks in the past few years now. It comes from Marie Ireland out of the Department of Ed in Virginia. And the idea is that we want to make sure in order to do a comprehensive assessment, we take and get information from all four quadrants, not just one or two. Especially working in the schools, we need to take into account the tests that students take as part of being part of general ed students. Looking at artifacts and doing observations in the natural environment are essential. And then we have our speech and language probes, and we have our norm reference tests. They're all important, but we need to do all of them. We can't rely only on one quadrant, and they're all equal. There's not one that should be more heavily weighted than others. This is from IDEA, that when you're planning assessment, no single measure or assessment is used as the sole criterion. So it's just reinforcing what I said before. And what is an evaluation for special education? Well, according to IDEA, it's procedures used to do two things: to determine whether a child has a disability and the nature and extent of the special education and related services that the child needs. So it's twofold, and you want to make sure that you're gathering information in order to identify disability or identify an impairment, as well as determine programming and what you need to do to support students in their IEP. So thinking back to norm reference tests and how they're just one part of the quadrant, they're just 1/4 of the model, it's because there are some limitations. They vary in their accuracy. They assume that all children have had the same experiences and opportunities prior to this point in time. And the skills that they assess are often associated with cultural and socioeconomic status, such as vocabulary. Kate Crowley is the leader of the Leaders Project at Columbia University. And if you want to look into that information further, you can look at that website. John Heilman also did a presentation on August 25th about the limitations of norm reference tests. That information is on the speech and language website. So, and this is just, again, talking more about the limitations of norm reference tests. There's an over-reliance on formal assessments and identification of speech language impairments. There's a lot of recent research on that topic. and that test selections are often not dependent on student needs or the psychometric properties of the test. So we need to be critical consumers of the tests that we administer. And in the area of fluency, I think that it's easier for us to make sure that what we're assessing is what the test is assessing is what we want to look at. These are considerations for students who are English learners. It's a reminder for us all that we want to make sure we assess children in both languages unless it's not feasible to do so. We really want to train and use our translators to get good case histories, to understand more the extent of knowledge and use of home language. This is true even with students who have disfluency. I definitely have worked with bilingual kids who are disfluent. And then we want to make sure we interview school staff regarding language use across settings. So one part of our criteria is that there has to be an educational impact, right? So there's an impairment and then it has an educational impact, and that's how we determine whether or not there are services in the schools. And there can be an academic impact or there can be social emotional impact. And these are some ways to gather information. I have seen IEPs where people say, oh, it could impact the student. We really need to be documenting that it in fact does impact the student. And so these are ways that Laura and I came up with to document the educational impact for students who have disfluencies or who have a fluency disorder.
I wanted to start again. It's kind of a nice transition from what Andrea had said and go on to the different purposes of assessment. So since I've worked in the schools, I know how challenging time management can be, especially at the beginning of the year. But when you're working with any disorder, but especially fluency disorder, you never want to lose sight of that third bullet. Now, for the first bullet, identify a specific condition, we are really lucky in the fluency world because parents and teachers identify it for us. When they say that they're having a concern of stuttering, most likely that's what is going to be happening. So our evaluation is not then going to come to that. It's already been identified. However, we may want to differentiate different subtypes or different groups of fluency disorders, such as cluttering or normal disfluency. That would be a purpose of assessment for fluency. The last bullet is very important because you work for the school, so you need to follow the guidelines and determine eligibility for school-based service. But really, and was kind of mentioned by Andrea, we want to understand the full nature of the disorder and the associated challenges so that appropriate treatment can be undertaken. And if you really keep this purpose of assessment in mind, what I have to say will make sense, because one of the things when I was working with some school-based clinicians was, why do I have to give this test, or why do I have to do that task for evaluation? Because they were looking at determining eligibility and differentiating subtypes and not bullet number 3. So that was just kind of an overview. So what we're going to do today is just 4 areas. So I'll kind of let you know when we've done with part 1 or part 2. I'll start with the types of disfluencies that you might see with children in the schools and a fast definition. Then I'll go into key points and background information to know about stuttering, because it might have been a long time since graduate school, or you didn't have a full fluency class in graduate school, and I just want everyone on the same page. And number 3 is that there's going to be some tweaks to the assessment depending on the age of the child, preschool to school age. And we'll definitely talk about the nuts and bolts, the components of a fluency exam. What kind of test would you give? Where can I find it? Is it free? All those things. I will have some case study questions for preschool, and then I'm going to present a case study for school age, and I'm going to intertwine it as if like we're really going through and doing the assessment together for that child. So I'll bring in step by step. So if we start with definitions, these are the categories of disfluency that I'm going to be talking about, and that's what you're going to see in the schools. I'm going to be talking about developmental stuttering and not the adult onset neurogenic or psychogenic stuttering. So developmental stuttering, stuttering that happens in a child's development, usually between the ages of 2 and 4. I'm going to start at the bottom bullet so that when we finish our definitions, we end up on stuttering. So then I can go into the key points of stuttering very fluently, I think. And then, so the first one is normal disfluency. And you're like, I know what that is. So we're all a little bit disfluent. If we look at a spectrum, even within people within the normal range, some are more disfluent than others. So you expect that people sometimes repeat things. I want to go somewhere, but it's usually no more than 2 repetitions. And we may have phrase repetitions and revisions. Definitely, I know I have interjections. But probably the second bullet is one of the ways that are it's a really strong way to identify a child who is not stuttering and a child who's stuttering, because the rate of repetitions are much slower in children who don't stutter. So normal children developing normally might say, and mommy's going to, or even and mommy's going to. Whereas a child who stutters, it could be much faster, and mommy's going to, similar to that. So a lot of research has shown that the rate of those repetitions tend to be much faster in children who stutter. The next one is really, I'm not going to spend much time on, but if we think of the bell curve, there can be children who have many normal disfluencies. You do a language sample and they've got these abandoned utterances, many revisions, utterance formulation difficulties, and they don't meet the definition of cluttering because there's no rate, fast rate, or a regular rate involvement. So these are the kids where you would work with them and look at the language guidelines. Then we have a typical disfluency, and there isn't tons of research about this. So we don't know if this is a subset of stuttering or something different completely. But if you get a child with these type of disfluency, it's very prominent. Often teachers are like, I think they're stuttering, but it's a little bit sounding different. It's often associated with children on the autism spectrum or children who have OCD, but I want to emphasize that it doesn't have to be a firm diagnosis. Maybe there's a subclinical tendencies towards neurological sensitivity. So the parents never brought the child in and got an OCD diagnosis, but yet they may have some very rigid behaviors that point to that, or they may toe walk at which is kind of a sign of some neurological sensitivity. So it doesn't have to be a diagnosis, but all the children I've seen with that have had a typical disfluencies plus. And how they might sound would be, I want to go to lunch, often these mid-syllable or insertions, kind of like a breathing thing. You might even think it's voice. We, he are going to home soon now. And that is something definitely you might come across, and you can always email me if you do, and I've got some good readings on that. The next is, yay, developmental stuttering. And it's important to realize a definition for developmental stuttering can be 2 different things. It could be from the listener's perspective, from the speech therapist, the parents, the teacher, what they observe, what they hear, what they see. It could be repetitions at the faster rate, more than 2 iterations, prolongations, actual stoppage of air, the secondary behaviors such as moving their hands or avoiding eye contact. But a person who stutters often defines their stuttering not by those speech behaviors. And I use this ABC to kind of help remember how they might look at it: affective, behavioral, and cognitive. And so what does that look like? You know, something happened. This slide got mixed up and we never did cluttering. So I'm going to go to cluttering now, and we'll go back a little bit to that. I don't know how that order got mixed up. I'm sorry about that. But cluttering then would be something that I think is a little bit underdiagnosed. And cluttering is a fluency disorder that in the past used to be defined very broadly. And so with cluttering, the researchers had difficulty knowing if they were talking about apples versus oranges. So around 2011, they were able to agree on what they called a common denominator or least common denominator definition of cluttering. So this is the scale down. This is what a child has to have. They have to have a rate that's fast, too fast overall, too irregular, or both. And then this fast rate, or this perceived fast rate, must be accompanied by at least one or maybe more of the following. For example, excessive normal disfluencies, the word repetition, the phrase repetition and revisions, the interjections, excessive collapsing or deletion of syllables. And that would be where a child might say, fortunately, as firstly, and television becomes television. And so our phrases go together, like, I want to have some fried rice becomes, I want fried rice. So there's talking so fast that words and syllables get cut out. And then abnormal pauses or stress or speech rhythm. I used to have difficulty understanding the difference between an irregular rate and abnormal pauses. And this is how I resolved it. An irregular rate could be you're talking and all of a sudden you have a fast burst. And then you're talking again and all of a sudden you have a fast burst. But in abnormal pauses, I'm going to use the Pledge of Allegiance to demonstrate that. So the first line is, I pledge allegiance to the flag of the United States of America. And abnormal pauses might be, I pledge allegiance to the flag of the United States of America. So it would sound quite different than what you would expect the pauses to go to. Cluttering is also defined broadly as a spectrum, and that other areas can be involved. I find that there is some lack of awareness of the problem. They may have a vague idea that something's different with them, but they may not feel that their speech is necessarily fast. There can be temporary improvement when they're asked to slow down or pay attention to their speech. And then less guarded moments, their speech returns to kind of a jumbled fast rate. There could be poor handwriting, definitely. And I am just going to give you a taste of cluttering. I have, and I should share my computer sound. And here we go.
You know, it's really affecting me and it's really affecting me and communicating and getting my point across. And it, you know, it's very difficult for me to talk. And especially when I started interviewing for jobs, I noticed that it really affected me because, you know, I'd go to an interview and I'd start, you know, like talking super fast, or I'd be like,
okay, so that is, so that link is in the assessment. And yeah, so, oh, you look at that. So yeah, this slide definitely got out of sequence. So I'll just put that back. We already talked a little bit about developmental stuttering. As I said, there's two definitions. Affective, behavioral, cognitive is what the kids who stutter, that's how they define it. And this next slide, if we're back to the right order, is taken from Joe Donaher's work at the University of Pennsylvania Children's Hospital. He's always asked children, what is stuttering to you? So the red I put in are the behaviors. So what do children do because they stutter? We often think of what do children do when they stutter? Oh, they're repeating, they're blocking. What they do because they stutter is also a very interesting and a necessary component of assessment. They may not be talking. They may be eating lunch by themselves, not volunteering, pretending to know, speeding up, holding back. What are they feeling? They might be feeling embarrassed, annoyed. They might be feeling sticky. What are they thinking? They might be thinking that they can't say it, that words are caught in their throat, that it's always there. So we want to understand those two levels of definitions for stuttering in our assessment. And then I'll end this first portion of this talk by giving Joe's definition of stuttering that I used to teach the class in Madison and Whitewater, the graduate class. And I had students memorize this definition because I liked it so much, because it is not anyone's fault. It doesn't go to the speech behaviors to define stuttering, but he says it's a neurologically based disorder, which we now know it is neurologically based, has a genetic component, and this disorder impairs an individual's ability to time and sequence the movements necessary for speech. It is not a set of speech behaviors. And over time, this underlying impairment can result in various things, such as what I've listed here under the bullet. It could be the characteristic speech behaviors, but also the reduced confidence, the feeling of loss of control for the speaker, the tension, the struggle, the pushing, anticipation of communication being difficult and thus leading to communication avoidances, or maybe even some tricks to get through that become incorporated into secondary behaviors.